Good morning, everyone. This is your Maven of Mystery, and I have you all know that I have had an infection in my feet. I don't know if you know that that's exactly what it is, but I have this port here because I was taking IV antibiotics. And, the way this whole situation came about was I went to my podiatrist because I had a very strange rash on my left foot. And I'm diabetic, so anything that involves my feet, I go to the podiatrist right away because I don't want to lose my toes. So he looked at it and he goes, "This looks like athlete's foot." So he gave me a remedy for that. And I did exactly what he said to do. But after 2 weeks, it looked like I had scales on my feet. It was, big honking flakes of skin that was hard. It was gross. And I went back to the podiatrist and he looks at it and he goes, "That's not athlete's foot." And I kind of agreed with him, and he goes, "I don't know what it is, so you need to go see dermatology." So in order to get into a specialty clinic, you have to go to your primary. So I went to my primary physician, and this took a couple days to get in there. She looked at it, and she recommended a steroid cream, and she referred me to dermatology. We put the steroid cream on it, and it lessened the scaliness of it, so that when I did go see dermatology, there was just redness, and my left big toe was swollen. So she took a look at that and took a culture of it because it was also weeping around the nail bed. And then, kind of sent me on my way, and gave me a prescription for antibiotics, doxycycline. So I started taking that, and the foot started to improve. The redness, went away, and when I finished the course of antibiotics, it came back. Everything just came back, and I was very frustrated, went back to the dermatologist. When I went back this time, I had the problems with my left toe, and I had a bluish green spot under my nail bed on my right toe. So I had them look at both of my feet, and they took another culture. They took a culture of, both of them. They had to use like a spatula type of thing to get under the nail of my right toe. And so we did those tests, and after the cultures came back, she said I had MRSA in my left foot, and the doxycycline would be treatment for that. And then there was Pseudomonas in my right toe, so there was another antibiotic for that. So I started taking these antibiotics. Later, a more in-depth result came from the right toe, and they said it was Pseudomonas and that it was resistant to oral antibiotics. So I would have to go to the hospital and get a central line put in so that I could have IV antibiotics at home. So I went to the hospital, the ER, and I was there a very long time in the waiting area before I was seen. And then I was seen in the emergency, anyway, I was seen. And they started an IV antibiotic. And they, when interventional radiology opened up, they were going to see if they could take me that day and have the central line put in. And they did. So then they sent me to the annex of the ER to await discharge or admission into the hospital. My doctor had said she was working on getting me discharged. So, she said, as if all the stars align, then I get to go home, which is what I really wanted. So, I got to go home. After I'd had a horrendous night in the hospital, I had one nurse who, although she knew that I had anxiety disorder, she really, I wouldn't say picked at me, but she really stirred me up really bad. And I got to, and this is 1 o'clock in the morning. I mean, it was so unnecessary for her to do what she did. And I had started yelling at her to page the doctor, and she finally left the room, because that's the only thing I could say was page the doctor, page the doctor. I was just like, anyway, she left the room, and then the charge nurse came in. Oh, and before she did that, another nurse, a male nurse, had come in and told me to lower my damn voice, which did not help. So that's when I started saying, page the doctor. So they both left. And then the charge nurse came and started admonishing me for requesting the doctor to be paged. And, what's the doctor going to do at 1 o'clock in the morning? It's like, why is your nurse bugging me to the point of anxiety at 1 o'clock in the morning? And Matthew walked the charge nurse out of my room and told her exactly what went on, because they apparently had given her a different story. So after this, I'm going home now. I've got the IV antibiotics and everything. It's going to be a regimen from September 7th to October 5th. And I even did a video on putting the antibiotic ball on and off. So I'm thinking, and one of my follow-up appointments was with my primary, and another follow-up appointment was with infectious diseases, because this is, an infection. Infectious diseases wanted me to go to my podiatrist and have both of my big toenails removed, because they said the antibiotic isn't getting to the area because your nail bed is only alive to a certain point, and then it's dead, so there's no circulation going to the infected areas. So I'm like, okay, because I don't know any better. And I don't have a medical degree, so I did that and made the appointment. So I just went to the podiatrist yesterday, and I am pissed. He looks at my feet, and he says, well, that's not Pseudomonas, that's a blood blister on my right toe. And I was like, what? He goes, well, that's a blood blister, and this is an ingrown toenail for the MRSA foot. And I'm like, that's not what they told me. And I was trying to explain to him what they had told me, and he didn't get it. And I was going to push to have these toenails removed because that's what the doctor said. So he goes out for a little while, and I can hear him talking to another patient, dealing with them. And I was getting kind of upset because, I'm on a time schedule. I have a bus that comes to get me, and if I'm not out there, they will leave me, and I won't have another way home. So I was starting to get anxious, And then the nurse came in and we talked. She goes, well, he'll be in here, in a minute. So I was like, okay. He comes back in and he says again that it's an ingrown toenail and a blood blister. And when I was telling him what I was told, he goes, well, why are you here? And I was like, well, they told me to come here. And so he looked up on the computer what photos of a blood blister looked like, and it looked like my toe. And so I'm thinking, And then I told him about the Pseudomonas, and he goes, we have bacteria on our skin. It doesn't necessarily mean that you have an infection in your toe. He said, so when they did a culture of your toe, they may have picked up what naturally occurs on our skin. So, basically, you've just had a month course of IV antibiotics for no good reason. And then he said, and this other one is an ingrown toenail. And he went like this and squeezed my toe, and it hurt. And when he took his hand away, there was all kinds of blood just coming out of my foot. I was like, oh my God. So he used this numbing spray, and then he shot me with something, lidocaine, or I don't know what the hell it was. It was a numbing agent. And he just, he waited for it to take effect, and then he went to work on that foot. And he excised the part that was bad, and he killed the nail bed a little bit as part of the treatment. And then he wrapped up my toe. I was like, so what I'm doing this for right now is be such an advocate for yourself. I seem to have to learn this lesson more than once because I've had issues, before. But I already have a compromised immune system because I took Remicade for hidradenitis suppurativa for about 6 or 7 years. And even though the doctor told me that it would compromise my immune system, I didn't realize exactly what that meant. And I didn't have, I couldn't verbalize my questions so that I could have him explain it further to me. I think he was coming from the fact that he knew what he was talking about. So when he told me, he figured I would know what it all meant. But a compromised immune system means that you are subject to whatever little things are flying around. That don't go to hospitals without a mask because you don't want to pick up things that other people are putting out. And, you just have to be really, really careful. So when they told me I had an infection, of course I wanted to, get rid of it. I wanted to use antibiotics. I didn't realize that some of these things were natural things to your system, so I didn't ask the questions. And I've gone through a month of this crap when I didn't have to. The other thing that really gets me is when the doctor is examining the podiatrist is examining my foot, he goes, when this happens, why don't you come to podiatry? And why did you go to the dermatologist? And I said, well, because you sent me there. And he had nothing to say about that. It was like, thank you. You're the one that started this. Anyway, I know this. I don't know if this is going to make much sense to anybody out there, but please don't take the doctor's word for it. They're human beings and they make mistakes. And it is so important because now I am resistant to a lot of antibiotics because of my compromised immune system. So you don't want to take an antibiotic that you don't need because your body will build up a resistance to it. So now, in the future, if I need Zosyn, I'm going to wonder if my body's going to reject it or not. Because was a month of taking it for nothing. So I just want everyone to be really, really good advocates for themselves. Ask questions. It may sound like you're stupid to yourself, but, you know, make sure that what people are giving you is the right thing. You know, I mean, the dermatology only did those 2 cultures. The one day on the big toe that was swollen and weeping a little bit. And then the next time I came in, another culture on that toe and the culture on the right toe. And then nobody else did any tests. Nobody. Not the emergency room, not infectious diseases, not my doctor. Nobody. So, I mean, that should have told me, you know, people need to check again. You know, test results can be, you know, a fluke. I did not realize that. So for your health, you know, have them, you know, test it and retest it. You know, there are times when the doctor makes mistakes. And I just don't want anybody else to go through this. I mean, I've got this in my neck and I want it out. It's been uncomfortable. I have an allergic reaction to tape, so it's been itching like crazy. I mean, for a month. So if I can save someone else from having the same issue happen to them, then it was all worth it. I mean, it's worth it to me if anybody can learn from my mistakes. So that's my tirade for the morning, and I hope that everyone is going to have a good day. If you have anything you want to say, please respond in the comments. If you like the video, give me a thumbs up. If you don't like it, give me a thumbs down. Please, if you give me a thumbs down, let me know why. Because I want to be able to grow and change, and that would just be really helpful for me. If you haven't, please subscribe to my channel, and I would just love to hear from you. Thanks. Bye.